Hi, I'm DrTonyWeston. Mindfulness for trauma, gentle techniques for PTSD and anxiety. Today we're discussing mindfulness, specifically adapted for those who've experienced trauma, PTSD or anxiety. Many people hear about mindfulness as a tool for stress relief, and traditional mindfulness practices can sometimes be challenging for trauma survivors. In this video, I'll explain why mindfulness can feel uncomfortable or even triggering for some, and I'll share trauma-sensitive techniques that are gentle, empowering, and designed to help you feel safer and more grounded. So firstly, why mindfulness can be challenging for those of us with trauma. Let's begin by understanding why mindfulness can sometimes be difficult for people with complex trauma or PTSD. Traditional mindfulness invites us to become deeply aware of our thoughts, emotions, and body sensations. For many, this heightened awareness is calming, but for those with trauma, it can sometimes increase discomfort or distress. When we're dealing with trauma, the body may hold on to memories and emotions in ways that feel unpredictable. Focusing inward can bring up old memories or activate a heightened state of alertness, which can lead to an increase in anxiety or even trigger flashbacks. This is especially true for those who experience hypervigilance, where they feel constantly on guard, or emotional dysregulation, where intense emotions feel overwhelming. This intense awareness can feel like confronting trauma head-on, making it difficult to relax. However, with the right trauma-sensitive techniques, mindfulness can still be a supportive practice without reactivating trauma responses. So secondly, trauma-sensitive mindfulness options. Now, let's explore a few trauma-sensitive mindfulness techniques that are specifically adapted to reduce the risk of triggering a stress response. These methods focus on grounding us in the present moment through gentle physical awareness. So, grounding techniques. One of the most effective approaches for trauma-sensitive mindfulness is grounding. Grounding techniques shift our attention to the external world rather than solely facing inward. A simple and powerful grounding technique is the 5-4-3-2-1 exercise. So this is, firstly, 5 things you can see around you. Secondly, 4 things you can touch, like the texture of your clothing or the ground beneath you. 3 things you can hear, even if they're faint sounds. 4 2 things you can smell, and finally, fifthly, 1 thing you can taste or notice about your mouth. This exercise helps bring your mind to the present, easing feelings of overwhelm without requiring deep internal focus. So next, mindful movement. Another gentle technique is mindful movement. For some, traditional sitting meditation can feel too intense, especially if it brings awareness to physical sensations tied to trauma. Mindful movement practices such as slow walking, gentle yoga, or even stretching can help us connect with our body in a supportive, non-threatening way. For example, considering a walking meditation. As you walk, focus on the sensation of your feet connecting with the ground, the rhythm of your steps, and the feel of the air around you. This practice promotes a sense of connection and calm without requiring you to sit still or focus intensely inward. Next, 4-7-8 breathing. Breathwork is often a core part of mindfulness, and certain breathing exercises can be triggering for trauma survivors. Instead of deep unstructured breathwork, try 4-7-8 breathing. So firstly, inhale gently through your nose for a count of 4. Then hold your breath for a count of 7. Exhale slowly and completely through your mouth for a count of 8. This structured rhythm provides a calming effect by gently engaging the body's relaxation response. The extended exhale helps to signal safety to the nervous system, making it easier to find calm without feeling overwhelmed. 3. Personalised approach and self-compassion. When practicing mindfulness for trauma, it's crucial to make space for a personalised approach. Trauma affects each of us differently, and there's no one-size-fits-all method. The techniques we discussed, grounding, mindful movement and 4-7-8 breathing, are starting points, and I encourage you to try them slowly, adapting them to fit your needs. Self-compassion is also key here. Trauma can create feelings of frustration, shame or self-blame, especially if certain practices feel challenging. Remember, it's perfectly okay to take things at your own pace. Practicing mindfulness is about meeting yourself where you are, not where you think you should be. 4. Why mindfulness is a journey, not a destination? It's important to view mindfulness as a journey. For trauma survivors, building comfort with these practices can take time, but small, gentle steps can make a big difference in reclaiming a sense of peace and safety. Think of mindfulness as a flexible tool. Some days a grounding exercise might be the most helpful, other days mindful movement or 4-7-8 breathing might feel best. Allow yourself to experiment, stay curious and listen to your body. There is no rush. Thank you for joining me in exploring trauma-sensitive mindfulness. If you have questions or insights, please feel free to share them in the comments. I'd love to hear from you. Remember, you have the ability to create a safe and supportive mindfulness practice that honours your unique journey. Start slowly, be kind to yourself, and know that each small step is a step toward healing. Until next time, take care.